Tuberculosis bacteria. User. Define tuberculosis bacteria. ChatGPT. Tuberculosis bacteria refer to a group of bacteria known as Mycobacterium tuberculosis complex, which includes the primary causative agent of tuberculosis, Mycobacterium tuberculosis. These bacteria are rod-shaped, acid-fast organisms that primarily infect the lungs but can also affect other parts of the body. They are transmitted through the air when an infected person coughs or sneezes, and they can cause a range of symptoms, including cough, fever, weight loss, and fatigue. Tuberculosis bacteria are responsible for the infectious disease known as tuberculosis, TB, which remains a significant global health concern. Classification. Tuberculosis, TB, can be classified based on various factors, including the site of infection, the severity of the disease, and the drug sensitivity of the bacteria. Here are some common classifications of tuberculosis. Pulmonary tuberculosis. This is the most common form of TB, where the bacteria primarily infect the lungs. It can cause symptoms such as cough, chest pain, fever, and coughing up blood. Extrapulmonary tuberculosis. In this form, the bacteria affect organs other than the lungs, such as the lymph nodes, bones, joints, gastrointestinal tract, central nervous system, and genitourinary system. Latent tuberculosis infection, LTBI. LTBI occurs when a person is infected with the TB bacteria but does not show any symptoms of active disease. The bacteria remain dormant in the body and can reactivate later, leading to active tuberculosis. Active tuberculosis. This refers to the form of TB where the bacteria are actively multiplying and causing symptoms. It can be further classified as primary tuberculosis, initial infection, or post-primary tuberculosis, reactivation of a latent infection. Drug-resistant tuberculosis. TB bacteria can develop resistance to one or more of the drugs commonly used for treatment. Drug-resistant tuberculosis is further classified into multi-drug-resistant TB, MDR-TB, extensively drug-resistant TB, XDR-TB, and totally drug-resistant TB, TDR-TB, based on the degree of resistance. These classifications help in understanding the nature of tuberculosis infection and guide appropriate diagnosis and treatment strategies.